The hypothesis being tested was, is saturated fat intake leading to increased major adverse cardiac events, heart attacks and strokes? The experiment that completed in 1973 showed no difference. There was no difference in cardiac events, despite the fact that the group that was on the higher polyunsaturated fat group did indeed have much lower cholesterol levels. Now this predated the subfractionation, so they weren't measuring LDL and HDL. They were just measuring total cholesterol. And at the time, there was some correlation between cardiovascular disease and total cholesterol levels. At the extremes, that was certainly true. Again, because I didn't think we'd be talking about this, I don't have the numbers all in my mind. But directionally, I believe that the higher PUFA group relative to the saturated fat group was about 30 milligrams per deciliter lower in total cholesterol. And based on everything we know today, we would assume that much of that was in LDL cholesterol indeed being lower and non-HDL cholesterol. And yet there was no difference in events. And of course, it's become a very famous and unfortunate story in nutrition research, and that Franz chose not to publish it because he didn't like the results. It didn't match his hypothesis, which was that the group on lower saturated fat would have fewer events. Ramsden went and published all of these data plus a whole bunch of sub-data just a few years ago, I believe in the British Medical Journal, and actually found something that threw a wrench in my initial hypothesis. My initial view of the Minnesota coronary experiment was it probably wasn't a long enough intervention. It might be that 5 years was not long enough to appreciate a difference. And so it was underpowered or too short in a duration to see a benefit, if there was a benefit.